Hello, everyone. Welcome back again. So we need a volunteer to present the cervical cancer. Anyone? Yes, Dr. Rika, please. Yeah, just unmute yourself.
Yes, ma'am.
Yeah, how are you, my dear?
Yes, ma'am.
Okay, so let's go to station number 7. So I will start now the 2 minutes reading time and then
Yes.
10 minutes to perform the station, okay?
Mm-hmm.
During the station, I will write on the screen the time remaining, okay?
Yeah, fine.
So 2 minutes, starting now. Yes, Rika.
Yes, ma'am.
Yeah, you can start. When you will start, I will start the timer.
Okay. Just give me 2 seconds, ma'am.
Yeah, sure. When you are ready, just let me know, okay?
Yeah. Okay, ma'am.
Okay.
May I start?
Yeah, you can start.
Hello, I'm Dr. Rekha in the General Gynecology Clinic today. May I confirm your name and age, please?
Hi, doctor. I'm Alison Furman. I'm 35 years.
How would you like to be addressed?
Alison is okay?
Listen, I gathered from your GP letter that you have some bleeding, and for that, some special scans were done, and you are here to discuss the same. Is that right?
Yes, doctor. Yeah, I want to know the results because nobody, doctor, discussed this with me. I'm a little bit anxious about my results, so I'm here to know the results, doctor.
I'm really sorry that you are going through a lot, but don't worry, me and my team are here to support you. Alison, is it okay if I ask first few questions and then discuss your results? Yeah, do you want me to discuss the results first?
No, it's okay, doctor, to ask questions. Yeah.
Okay, thank you for giving me the chance. So, can you tell me why you go through this test? Am I
Yeah,
right?
actually, doctor, I had like a bleeding, especially after the intimate relationship and in between my periods.
Mm-hmm.
And I went to the GP because I had a very bad history before.
Mm-hmm.
There was a procedure done for me, like cutting of the neck of the womb, as I can remember. It was 5 years ago. So the
Okay.
GP at that time, he asked me to go directly for the camera test. And
Mm-hmm.
then offered me this scan and this imaging, but I don't know why.
Mm-hmm. Okay, I will explain you in a moment. And apart from this, have you noticed any change in your weight and appetite?
No,
Any problems with waterworks and bowel?
no,
Any tummy pain or any foul smelling discharge?
no, doctor.
Before that, as you mentioned that 5 years back you have this procedure. Before that, your all smears were normal.
Yes.
Okay.
And
Uh,
after that, also, doctor, they offered me one test after the treatment, and then they discharged me back to the routine one, and it was normal.
okay. Some of my questions might sound intrusive, but it will be helpful for to formulate my management plan. Is it okay if I continue?
Yes, doctor.
Okay. Since how long you are with your partner?
It's now like 2 years.
Okay. Any previous sexual relationship?
Yes.
At any time you were treated for sexually shared infection?
No.
Mm-hmm. Okay. And any allergies that you are aware of?
No.
Ever you been pregnant before?
Yes, doctor.
Okay. How many kids you have?
I have two.
Okay. And how they were delivered?
It was by cesarean section.
How was the recovery afterwards?
Yeah, it was good.
Okay. And is your family is completed? Do you think?
Actually, no, doctor. I want another baby.
Mm-hmm. Okay. And so, any health issues for which you're following your GP?
No.
Okay. Any operation in the tummy and down below apart from sections?
No.
Mm-hmm. What contraception were you practicing?
I'm practicing. I'm taking these pills. You know, doctor, the small one.
Oral contraceptive pills.
Yes.
Okay. Do you use the condoms for the safe sex practice?
No.
Mm-hmm. Okay. Any family history of cancer related to womb, tubes, and ovary?
No, doctor, at all.
Mm-hmm. Okay. Do you have enough support at home?
Mm-hmm. Yes, my partner is very supportive.
Good to know about that. Do you feel down, depressed in last month?
No, doctor, I'm good. I'm anxious, as I told you, because of this
Mm-hmm.
problem. You know,
I completely understand your concerns. What about your BMI?
it's around 27.
Thank you for sharing your all this information. Anything else important you want to add?
No, doctor.
Okay, if you allow me, can I examine you in the presence of chaperone just to check your general health and tummy from the down below to
Mhm.
see that your area is healed well? Is it okay?
Oh, yeah. Yes, doctor.
Okay. Before discussing your report, do you want me to call someone to be with you because I have to give you a lot of information?
No, doctor, please go ahead. I cannot wait.
Uh, I have confirmed your name and NHS number, and I'm really sorry to tell you that I have some serious concern regarding your report, and I have some difficult news to discuss with you. Uh,
Mm,
act- act-
Say
uh,
to me now, doctor. Yeah.
Actually, your report shows that there is a cancer in the neck of the womb, and that has spread beyond the neck of the womb, involving the supporting structures. That is a stage 2B cancer.
Cancer, doctor? Are you serious, doctor?
Yes, I'm really sorry to be bearer of such news, but your scan report shows that.
No, doctor. Are you sure, doctor, this is my result?
Yes, I have confirmed your name and NHS number. I know it comes as a shock to you. If you want to take some time, we can discuss this later on.
No, doctor, please go ahead. But why, doctor, this happened to me? Why? I received the treatment 5 years ago and it was okay after that.
Your concerns are completely understandable, but it can happen sometimes without any reason also. But don't worry, there are the treatment options available. My team will be taking care of you.
Doctor, my question now, is there any cure for this cancer?
Yes, of course, the treatment options are available in the form of surgery and some anti-cancer medications and X-ray radiations are available. But I'm really sorry to tell you that the surgery will not be a suitable option for you because as the cancer has spread beyond the neck of the womb. So what are your thoughts?
I don't know, doctor. So how you will offer me treatment, doctor? And you said now the surgery is not suitable for me.
Yes, but before that, I need to involve the team of the doctors, and we will refer you to the team of the specialists within the 2 weeks, including my consultant will going to talk to you, and I will refer you to the cancer specialist doctor, and this Macmillan nurse will going to support you in this situation. Are you with me so far?
Yes, doctor, I'm following you.
And
Doctor,
also,
I want to ask, sorry, doctor, for interruption.
yes, please.
I will die, doctor.
Please don't think in that way. I can see that the news has come as a shock to you, and but word cancer itself will be scary for you. But don't worry, the treatment options are available. But at a and we will be taking care of you, and we will try to improve your quality of life.
Okay, doctor. So, doctor, what about the options I have?
Yes. So first of all, we need to do some blood test to check your blood strength and how your liver and kidney are working, and a chest X-ray to see the spread, and also CT scan will be arranged to see the spread of the cancer in the other areas also. And also the examination will be done by putting you the sleep. Once these all tests are available, we will discuss with you the options. Are you with me so far?
Yes, doctor, I'm following.
So, do you want me to discuss about about the anti-cancer medications, which will be suitable for you?
Yes, please, doctor.
So, the treatment will be in the form of the radiotherapy, which is an high energy beam will be given to destroy the cancer cell, and it will be delivered to your tummy and also to the local area to kill the cancer cell. And also, sometimes it can destroy the normal cells. By doing this, we can prevent the spread of the cancer to the other parts of the body. Am I clear so far?
Yes, doctor, very clear.
But there are some side effects like you may feel sick, tired, and some problems with the waterworks and bowel. But the medications are available to deal with this side effects. And also sometimes it can cause the narrowing of the vagina. Also, that can cause the difficulty in the sex in the future. But we will provide you some lubrications, gel, and also. Some problem also the we will give the dilators also if you feel that. Am I clear so far?
Yes, doctor, very clear. Yeah.
Any questions you have up till now?
No, doctor.
Okay, so some special anti-cancer medications will be given to kill the cancer cell. They will kill the normal cells also. It can cause some nausea, vomiting. You may feel tired and some hair loss and mouth sores you will feel. So the combination of the treatment will be given by the specialist cancer doctors. And after the treatment, the follow-up is very important because there is a chances of coming back also. Are you following me?
Yes, doctor.
So any questions you have?
So, doctor, there is no rule at all of surgery just to remove this cancer?
Actually, at this point, as the cancer has spread to the surrounding areas, in that situation, if we go ahead with the surgery will be extensive, including the removal of the womb and some part of the vagina, and the also the tube that connects the water pipe to the kidney. So this will be the extensive surgery, but the decision will be discussed by the team of the doctor. Whatever they decide, they will discuss with you.
Okay, doctor.
I understand that going through this will be very difficult time. So I will connect you with a counselor and support group. And if you need any kind of support, we are always here. Any questions you have?
No, doctor, thank you.
Okay, so I will give you some written information and write back to your GP about our agreed plan. I will arrange these tests and also arrange the appointment with the specialist team within the 2 weeks as soon as possible. Thank you so much.
Thank you, doctor. Okay, very well done, Dr. Rika. Very well done. So it's a very tough station, but you did excellent in this station. I will go first with the excellent points and good points in your station, and then we will go with the detailed feedback on the start. So I like your way you're counseling the patient. You have very calm voice. It's very important to speak with the patient very clearly, not to be very fast or very slow. So excellent. You you showed empathy throughout the station, saying "I'm so sorry" many times about any problem, like any complaint, like or the options already she has now, and because she has advanced cancer, so the surgery has no rule here. So excellent, my dear. Asking about the allergy, cervical screening in details. It was excellent also. Giving the options, especially you highlighted more the radiotherapy, and this is the trick of this station. Just to speak, give all the options, but highlight more the best option for the patient or the suitable option, which is the radiotherapy. Giving her the types, external or internal. Also, you give her the side effects and how to reduce these side effects. So very well done, Rika.
Thank you, ma'am.
You're welcome, my dear. Also, your breaking bad news was excellent, giving first signpost, second signpost, confirmation of the name on the report. It was excellent, all of these points. Coming to the detailed feedback.
Mm-hmm.
So, introduction, agenda, I don't have any problem. So you started to just to introduce yourself, confirming the patient name, and after that, asking her, how would you like me to call you? And then setting the agenda, and you confirm that the patient here to know the results. And I said, yes, and you showed empathy here. Very well done. Then information gathering. History of the present illness, you started to ask about the red flag signs. Yes, you can start with weight loss, loss of appetite, any problem with the water work, bowel work, it's all covered from your side. Any pain? No. The patient here, the main complaint is the bleeding, and it's postcoital and intermenstrual. So you can analyze this a little bit more. So asking about the amount, is there any blood clots? So you know now it's severe bleeding or not. You asked her about the lump, no lump here. So very well done. Just analyze more about the bleeding.
Yeah.
Then the personal, you didn't ask about the smoking. So
yes,
just,
I forget.
Yes. So take care of the personal history, smoking, alcohol, recreational drugs, especially the smoking, because smoking usually it will have, if it will
Can
not
be
have
linked with the cervical cancer.
Yeah, exactly. Even if it will not have direct impact on the cancer, it will affect the recovery after that. It will affect the response to the treatment. The smoking is affecting everything in our body. So it's very important. BMI covered. Drug allergy safety point here covered. So very well done. Menstrual, you didn't
about the menstrual history. I did not ask. I forget also.
Yeah, exactly. So we need to ask the patient has like bleeding in between the period. So ask her about heavy periods. And what about the regularity? Contraception already covered, and the patient on pills. Obstetric covered, very well done. Gynecology, cervical screening here. Yeah, the patient coming with the cervical cancer, but we want to know what about she was adherent to the cervical screening or not after the treatment. The cutting of the neck of the womb, she had the test of cure or not? I told you this by myself.
Yeah, you told by yourself. That's why I did not ask.
Yeah, exactly. So if the patient will not tell you like, I had the test of cure, or I had the routine cervical screening after that, or discharged back to the routine call, so ask her, do you have a test after the treatment? Yes, it was okay. Yes. After that, discharged back to the routine call? Yes. So just to be sure, because some of the patient will not be adherent to the cervical screening.
Okay, fine.
For the sexual, I like here that you give her signpost that it's a little bit intrusive question, so very well done. In the sexual history, guys, in any module, in any station, please give one signpost. So now, Alison, I'd like to ask you some personal questions. I know it's a little bit intrusive, but it's very important in our management. Shall I proceed? Yes, doctor. Here, the importance to exclude multiple partners, and excellent, you did it. You asked about the current relationship. She's with the partner for 2 years. Previous relationship, yes. So there is no multiple relationship at the moment, because once the patient in a stable relationship, so no multiple, you will ask about this. Are you in a stable relationship? Yes. For how long? 2 years. Okay, done. You asked about sexually shared infections. Very well done, Rika. Then medical, covered. Surgical, family. And you asked about the ovarian and womb cancer, bowel cancer, breast cancer. Also, you can ask. Mental, covered, and support, covered. So very well done. Just we want to add the smoking, alcohol, and you can ask about also the transfusion concern if this patient will go for a surgery. But our patient, she will not go. Yeah, but sometimes the patient will ask you like I asked you, the surgery, and your answer was excellent, because it will be on individualized basis. Sometimes you can give the patient the treatment, even she's stage 2 and she can go for the surgery. But for the purpose of the exam, guys, no rule for surgery for stage 2. But it's written in papers and research that, yes, it can be on individualized basis. So I like your answer, Rika, when you told me that the group of expert team will discuss this together, and we will come back to you with the result. So very well done, because it will depend on all the investigations offered to her. You offered her examination. Very well done, Rika. And yes. Then you start to explain the condition and explain the report. Even here, we don't have a report. Usually, I'm telling my candidate that please, if you don't have a report, but usually in the exam, you will find the report. But if you don't find a report, please say after confirmation of your name, because you will find the name of the patient on the top of the case notes here. If we have a case notes here, you will find the name here and the date of birth, NHS number, and the case notes, and you can find the results like involved in between lines. So still you have the name here on the top, so you have to confirm the name. You did the Breaking Bad news, first signpost, second signpost. If you want to discuss the cervical cancer, it's presence of abnormal cells in the neck of the womb. Very simple explanation. Even you can discuss with the patient, you can draw for the patient, and I like this, and especially now all the exams are face-to-face, so you can use drawing. So this is your womb. This is your womb, and this is the neck of the womb. I can erase this one. So this is your womb here, and this is the neck of the womb, and this is your frontal passage. So the cervix, it's the neck of the womb. It's part of your womb, or it's the lower part of your womb. If the patient, we reach the point that the patient, she doesn't know the cervix, so you can discuss like this, or you can explain it like this, okay? Usually it will be the cervical cancer, very common in the young age, like 25 to 45 years. Okay, some cases will be in younger women and some patients, but very rarely to be in old patients. So this is how to discuss the cervical cancer. So your management has to be with a group of expert team, or will be with a group of expert team. This will include my consultant, a specialized nurse, cancer center team, imaging specialist, radiotherapy technician, because we will offer this patient radiotherapy specialist, radiotherapy consultant, and a counselor. And also you offered her a counselor and someone to support her during that. And also you offered her a support group, Rika. So we do have 3 options to treat the cervical cancer: either surgery, radiotherapy, or chemotherapy. Shall I proceed? Yes, doctor. So at the start, we need to offer you further investigation. An excellent, Rika, you covered this. The level of the blood, how is the kidney work, how the liver work, and also CT scan. We can offer MRI already done. Chest X-ray to exclude any distant metastasis, very important. Ultrasound scan and a blood test. What about the aim of all these investigations? The aim to give a stage for the cancer. So to explain the staging to the patient, so the staging showing how much the tumor has grown, and also whether the cancer spread to local lymph nodes or not, or other areas of the body. So that's why we need all these investigations to put it all together to have a clear picture about your condition. Am I clear so far? Yes, doctor. What is staging? If you want to discuss, the patient asked you, I will die, doctor? Yes, correct, I will die. It's a very famous question in the exam. So you can, if you cannot remember the numbers, and for myself, I cannot remember the numbers, guys. So no problem. You can answer the question, don't lose hope, and we are all here to support you. It's very difficult to answer this question now, Alison. I'm so sorry about that, because we don't have a clear picture or the whole picture about your condition. Still, we have further investigations to be offered, like imaging, blood test, chest X-ray, another ultrasound scan. So we need all this together to answer your question. But I'd like to reassure you that if the cancer, if you don't have the stage in the exam, but here the patient has stage 2 cervical cancer. So stage 1, around 95%. It was 79%, guys. I will mute you, Rika. Yeah, thank you. You muted yourself. Thank you so much. Just to have a clear recording. It was 79 now, because now cervical cancer can be detected early, and we have like update in the management and proper management of the patient. So now the survival rate, and this is in the 5 years after the treatment. So it's the first 5 years, the survival rate is 95%. In stage 2, here the cancer invaded beyond the uterus. And you can use these stages here, okay, in a layman language, and to be simple. Also with the drawing, you can draw like this. And if the cancer still here in the neck of the womb or the womb itself, so within the uterus or the womb, it's 95. If it's beyond the uterus, so it's outside the uterus, either here in the tissue around or just beside the uterus or the womb or the neck of the womb, so the survival rate is around 70%. If it extends more to the lateral pelvic walls, so in layman language, you will tell the patient, if this cancer or this tumor reach the lateral walls of your lower tummy, at that time the survival rate will be 40%, or the lower one-third of the vagina, or the frontal passage in layman language. So it's 40%. If it's spread beyond the pelvis, it means like abdominal, so spread in your tummy, in your lungs. So at that time, the survival rate will be 15%. So these percentages or survival rate, it's from the cancer research. In the National Cancer Institute, it's almost the same, but they are not giving in stage 1, 2, 3. You can use this. It's a little bit more simple, okay? So if the cancer is still in uterus or in the womb, it's 90%. If it's outside the womb, so it's around 60%. If it's away from the womb, like in the lung, the liver, or any place, so it's 15%. And overall, before knowing the stage, the overall survival rate is 67%. So use whatever you want. This is the National Cancer Institute in UK, and these numbers here from the cancer research. Okay, and it's near each other, like here 90, 95, here 60, 70, 15, it's the same here. Okay, guys? So this is the survival rate. If you want to remember the numbers, if you cannot, like me, so just say like the answer of Dr. Reka. Like, it's very difficult to answer this question now, and we will have all these investigations, and we will come back to you the final or the accurate number if you want a number. But don't lose hope. We are all here to support you. So at that time, you are in the midline. You didn't give the patient, or you didn't give her like false reassurance, and you didn't tell her like wrong numbers. You got my point? So just be neutral in between. And I like this answer, by the way. The aim of the treatment, you can use also this to discuss with the patient how the cancer will be treated. And at point of time, you will tell her, I'm so sorry, this point not, or this aim, it's not applicable in your condition. Because the second question in the exam will be, is there any cure from this cancer or not? So the aim of the treatment, either to cure the cancer, this is number one, to control the cancer, or to ease the symptoms. Am I clear so far? Yes, doctor. So for curing the cancer, it means that we will remove all the cancer cells as much as we can. We will not leave anything behind us. And usually this happen in the early stages of the cervical cancer. Usually even not stage 1, usually it's in stage 1A to have cure of the cervical cancer. And I'm so sorry, Alison, if you are discussing with the patient, I'm so sorry, it's not applicable in your condition because already the cancer spread to outside the womb. The aim number 2, or the second aim, control the cancer. So at that time, the aim of the treatment to control the cancer from growth or spread. So limiting the growth and limiting the spread of the cancer. And this is in your condition, Alison, to limit the growth and the spread. Number 3, easing the symptoms. It's in the very advanced cases, like in stage 4, just to give palliative treatment, guys. So just to give the patient analgesics, like strong analgesics, even morphia, to ease the symptoms. You know the word or the expression painless end of life? Here, this is the easing of the symptoms. Sometimes we can use the radiotherapy palliative. How to use it palliative? The cervical cancer, especially the cervical cancer, guys, if it's invading the parametrium, usually it will make compression or invade around the ureter, okay? And the back pressure will be towards the kidney, and the patient will present with hydronephrosis. So at that time, we will give the patient radiotherapy to ease this symptom or this problem. You got my point? So even the radiotherapy or the chemotherapy can be used palliative to ease the symptoms of the patient. Okay? Like here, look here, some treatment may be used to reduce the size of the cancer, ease the symptoms such as pain. Okay? So 3 aims, guys: cure, control, easing the symptoms. So if the patient will ask you about cure, I'm so sorry, it's not in your condition, it's not applicable in your condition. However, please don't lose hope. We are all here to support you. And the group of expert team will sit together to see what about the best option for you. Sometimes we can say at the start it's not applicable, but with the response of your body to the treatment, we can say after that, yes, we can do the surgery. But it will be the decision by the end of the group of expert team, the multidisciplinary team, guys. So the options, first option will be the surgery. I write here like types of the surgery. It's not in our patient, it's not in Alison, but this is if the RCOG decide to have another case like stage 1 cervical cancer, stage 1A cervical cancer, and the patient, she wants further fertility or future fertility. So at that time, you know that trachelectomy is a good option for this patient. So you can answer here the question of the surgery. Yes, we can remove the neck of the womb. And we have 2 types of the trachelectomy, either trachelectomy only or radical trachelectomy. What about the difference? Radical trachelectomy, removal of the cervix and the parametrium. It can be done in very early cases like stage 1A2, where the patient has fertility wishes. Hysterectomy or radical surgery after that. And usually the limit of the surgery will be stage 1B or 2A. I will come to this. It's extra slide by the end to know if we have any stage of the cervical cancer, you will know the exact treatment for that. We will come to this in 3 or 4 minutes. Radiotherapy, the second option. So you will touch the point of the surgery and say, I'm so sorry, it's not suitable, like you did, Reka. It's not suitable in your condition, and it will carry a lot of risks for you if we will do it, and we will not be sure that we will not leave anything behind us. The aim of the surgery to remove all the cancer cells. If we will not be able to do that, so why to go through the surgery? It will carry more risk for the patient. Yes, so it's not suitable here. The second option is the radiotherapy, and this is the best option for you. We do have 2 types of radiotherapy. At the start, define the radiotherapy. 1 minute, guys. I mute you, Dr. Ruma. Please just keep yourself muted, all of you guys, to have a clear recording after that. So the radiotherapy, start with the definition. It's high energy beams of radiation, which are focused on the cancerous tissue. It will kill the cancer cells or stop the cancer cell from multiplying. And I'm so sorry, Alison, to tell you that while this radiotherapy or radiation will kill the cancer cells, it will affect the normal cells as well. So you will have some side effects because of the affection of the normal cells. It might be a hole in your bowel, which is the fistula, dryness in your frontal passage, pain during sex, inflammation or problem with your water work, and burns of your skin. But we have now many ways or many things to apply for you to reduce these effects, like to have shield while taking that, or while application of the radiotherapy will be done for you. Application of special creams and gel. Now it's used, guys, here in UK to apply special form of cream, gel to reduce the burns of the skin. For the dyspareunia and dryness, I like your way also, Reka. You mentioned that you will offer her also lubricant and some creams to help her in this problem. Okay, the most common side effects, do you know, guys? Just brainstorming. The most common problem with the radiotherapy. Do you remember from part 2? Anyone?
Narrowing of the skin, ma'am. Burns.
Sorry?
Narrowing of the skin. Burns and narrowing of the skin.
Burns, yes, but the most common is the dyspareunia, 55%.
This is the narrowing of the vagina this causing, no?
Yeah, yes. Section of the vagina, 55%, especially with the internal form of the radiotherapy, 55. Fistula around 15%. Okay, but the most common is the dyspareunia, and this is the most annoying problem in this patient. So the definition first, how it will work, and you did it, Rika, and then the side effects, how to reduce the side effects. So look here, guys, how you will go through the station. It will be like that. Then we will have 2 types, or we have already 2 types of the radiotherapy, either to have external radiotherapy, where the radiation is targeted on the cancer from outside, on your lower tummy or tummy. The internal one, or what we name the brachytherapy, it's placing of small radioactive implant. It's like balls next to the neck of the womb. So it will be focused on the cancerous cells or tumor. And usually it will be for a short time. But the patient, sometimes with the brachytherapy, we need to admit the patient overnight to receive this brachytherapy. Okay? So just discuss or define the radiotherapy, how it will work, side effects, the types, and then ask the patient, am I clear so far? Yes, doctor. Here, the last paragraph, it's regarding the palliative one, like using radiotherapy to shrink the secondary tumors which have developed in other parts of the body. 1 second, guys. Sorry for the interruption. So here, using of the radiotherapy as palliative to ease the symptoms like hydronephrosis or the pain, so we can use it to shrink the size of the tumor. Chemotherapy can be used here alone? No. So please don't give the patient the option of chemotherapy at the start. Make it at the end and highlight to the patient we cannot use the chemotherapy alone because the cancer of the neck of the womb not sensitive to the chemotherapy. Usually we will use it for any distant metastasis or distant cancer. Even it's still in the pelvis, but the radiotherapy will not affect this cancer, so we can use the chemotherapy. So not used alone, it has to be radiochemotherapy, okay? And used in special situations like distant mets, even affection of like liver or peritoneum, so we can use the chemotherapy because the radiotherapy will not be applicable here. You got my point? But alone, no. You can also give some side effects because we have to give the pros and cons. So what about the pros here? The advantages, it will kill any cancer tissue away from the womb. What about the disadvantages? Feeling fatigued, feeling ill, it will lower the level of your blood. You might have this mouth ulcers and loss of hair. So usually the side effects of the chemotherapy will be the fatigue, the anemia, mouth ulcers, and loss of hair. Okay, guys, so this is how you will tell the patient about the side effects of the chemotherapy. So now, before coming to this slide, which is extra, after giving the patient the 3 options, so do you want to ask about anything, Alison? No, doctor. So I will give you the patient information leaflet regarding what we have discussed, set another appointment, and excellent, Rika, you write back here to the GP because we have a referral letter. At the start, it was mentioned that the patient referred from the GP. So you have to answer the GP to give him, to write back to him that we discovered cancer and we will do this and that, okay? Coming to the extra slide. And here, what about the aim of this? As I told you guys, if we have stage 1, stage 4, stage 2, 1A, for example, 1A2, how to manage the case. So in stage 1A1, and the patient still young and she needs further fertility, so you can offer her loop excision, leads. It can be adequate, maybe adequate as long as excision margins are clear. And it will come back from the histopathology like clear margins. While if the excision margin is not clear, please repeat the excision or simple hysterectomy if the patient completed her family. And the fertility is not an issue. In our patient, the patient, she wants further fertility, but already she has 2 children, 2 kids. So here fertility, it's not issue. It will be issue if the patient is nullipara. So the patient has no babies. At that time, yes, we have to think about it. Stage 1A2, cancer, the standard treatment, look here, guys, radical hysterectomy, even no simple hysterectomy here. The cervical cancer, it's aggressive form of cancer. So radical hysterectomy with bilateral pelvic lymphadenectomy. It's in stage 1A2. If fertility is still required, radical trachelectomy has to be offered at that time. And after the patient completed her family, you can offer her to complete the surgery if you are afraid that there is the high risk of recurrence at that time. And it will be on individualized basis as well. If the patient has a stage 1B or 2A, it has to be on individualized basis. Is the surgery, major surgery, suitable or not? What about the patient preference? Okay, and at that time, the options include radical surgery or radiotherapy. Stage 2B to 4A, here cancer is advanced, and at that time, radical chemoradiotherapy will be offered. Stage 4B, palliative radiotherapy, and that's it. If there is no, if you don't need palliative radiotherapy, so you can use just palliative analgesics, okay? Starting from the simple painkillers till the morphia. So this is different stages, guys. And as you can see, you're welcome, Dr. Rika. Thank you so much, my dear, for your nice performance. So as you can see here, guys, in the cancer cervix, usually it's advanced, usually it's aggressive, and the treatment also has to be aggressive. So from stage 2B, it has to be radiotherapy, no rule for surgery here. However, in some researches, because I got this question from one of my candidates, that we can even still offer the patient surgery here. Yes, but it's on individualized basis. So for the sake of the exam or purpose of the exam, no, it's not suitable. If the patient insists, do like Rika did, I will discuss with my consultant, or the group of expert team will discuss together. We will wait for the other investigations. You got my points? Just to be safe, okay? Don't tell yes or no if you are not sure. Yeah, the side effects of the surgery. Yes, good question, Rika. For the surgery, guys, we have one famous line you can put in any surgery. So for the surgery, the risk of the surgery, any surgery, even if it's simple, infection, bleeding, bruises, injury of any organ inside your tummy or lower tummy. So here in the cervical cancer, it will be the same, yes. Plus, because this patient has 2 cesarean sections, so you will highlight the point of adhesions or scar tissue, and the risk of injury to the tube connecting the kidney to the water bag will be more. Risk of injury of any blood vessel and bleeding inside your tummy and lower tummy will be more. The risk of blood transfusion, and sometimes it will lead to, unfortunately, it will lead to death even. The complications of anesthesia as well, guys, you have to mention. And any injury of the bowel, blood vessel, urinary bladder, ureter. Okay, you're welcome, Rika. So use the famous line, but here we will add that the risk is higher and higher. The risk of blood transfusion will be higher. Risk of death will be higher. Risk of the complications of the anesthesia will be higher. Okay? Then finishing that or ending the stations. Okay, thank you so much, Rika. So guys, do you have any questions in this station? We didn't finish. Still we have ovarian cancer, but because this is the last station in this presentation. So first, do you have any questions regarding the cervical cancer?
No, ma'am, clear. Thank you so much.
You're welcome, my dear. For any other surgeries, guys, just this line, any other surgeries, even if it's simple, like drainage of abscess, for example. So it's a simple surgery or a simple procedure. However, it carries some risk for you, like infection, bruises, bleeding, injury of anything like porcelain abscess. So it will be injury of the urethra, any organ around the area. So there is a risk of injury of that organ. You got my point? So if it's simple, you will tell like this. If it's radical, for example, radical hysterectomy, like in our patient, if the patient condition, the surgery here is applicable for her, so you will you will give the one line and then increase the more risk here, or add the more risk. Okay, guys? So we will stop again. We can have like 10 minutes break and we will come back with the ovarian cancer. Very important station as well. And I need one volunteer again. So do you want to decide now if anyone wants to do the station? So you can prepare in the 10 minutes. Yes, Dr. Roma, you can do. Okay, so 10 minutes and then we will come back to discuss the ovarian cancer. Okay, thank you so much, guys.